Hello to all the wonderful doctors out there. Today, my topic for the presentation in this international webinar on cupping is Ayurveda and cupping. I am Dr. Anup Pesanan, BAMS from Bharati Vidyapeeth, Pune, and DYA from Tilak Maharashtra Vidyapeeth, also in Pune. I am an Ayurvedic consultant practicing in Kuwait for the past 8 years. I have been working as an Ayurvedic physician. I had been working as an Ayurvedic physician in Nasti Ayurveda, Slovenia, in European Union. I was the ex-manager and physician at Birla Integrated Wellness Center, Jaipur. I was the medical officer at Shantigiri Ayurveda and Siddha Vaidyashala, Ahmedabad. I was the manager cum Ayurvedic physician cum aesthetic therapist at Talwakers Pantaloon Fitness Private Limited, its branch at Noida. Now this topic will be viewed in the following subheadings. First is the introduction, where we'll know about what Ayurveda is and what is cupping treatment. Second is the cupping in Ayurveda, means how cupping therapy is practiced in Ayurveda, the Ayurvedic version of the cupping. The Ayurvedic cupping in knee pain, means to understand the cupping therapy of Ayurveda in further, we'll take a case study of knee pain and how cupping therapy, Ayurvedic cupping therapy is done in knee pain. We'll understand that. To know that, we'll first have the introduction of what knee pain is. What is the knee, then we'll see what's the anatomy of the knee, how knee joint is formed. Then we'll know the causes of knee pain, the etiological factors, then symptoms, how knee pain can manifest itself, how then we'll see the diagnosis, how the diagnosis can be made, how the different types of knee pain can be identified as different conditions. So through the various lab investigations, imaging tests, etc. Then we'll see how the Ayurvedic cupping treatment module is planned, what all could be done. And finally, we'll see more suggestions, what all extra things could be done apart from the treatment discussed here in line with the Ayurvedic cupping treatment. Now, the introduction. Ayurvedic medicine is one of the world's oldest holistic healing systems. It's about 5,000 years old. So when we say the holistic system or which is the whole body system, it means that it doesn't just treat a particular disease, but revitalizes the person as a whole. Ayurveda believes that everything in the universe, dead or alive, is connected. Hence, like the universe, every person is made up of five basic key elements found in the universe. We call the Panch Mahabhuta. These Panch Mahabhutas are the sky, the air, the fire, water, and the earth. These Panch Mahabhutas combine in our body to form three vital life forces or energies called as the doshas. They control how your body works. They are the Vata dosha, which is a combination of the sky and the air, the Pitta dosha, which is a combination of fire and water, and the Kapha dosha, which is a combination of water and the earth. Now, everyone in this universe inherits this unique mix of all the three doshas right at the time of conception, which constitutes his or her body constitution. Like when a child is conceived in the mother's womb, this combination of three doshas occurs, and the body constitution is determined at that particular time. This body constitution determines the person's gross physical and psychological features. Even the tendency of contracting a certain class of diseases also depends on this body constitution. Like practically, if you say there are people who don't eat anything, means hardly eat anything, and they gain weight as soon as they eat slightest of things, they gain weight faster. And there are another class of people, another class of individuals who eat so much and yet they don't put on. It all depends upon the body constitution. It's not a mathematical thing that this much calories means this much weight gain. It all depends upon person to person. And this person to person, this variation is because of the variation in the body constitution. When something disrupts this balance of the doshas in the body, you get sick. Among the things that can upset this balance are genetic or birth defects, injuries, diet, lifestyle, climate, and seasonal changes, age, and your emotions. If your mind, body, and spirit are in harmony with the universe, you will have a good health, else, you will fall sick. In short, the balance of doshas is the key to good health, and imbalance means diseases. Now, further, uh, like Ayurveda, cupping is also an ancient medical practice prevalent in several parts of the world and mainly in China and the Middle East. Cupping involves the suction on the skin using glass, ceramic, bamboo, or plastic cups. The negative pressure is created in the cup either by the applying flame to the cup to remove oxygen before placing it on the skin or by attaching the suction devices to the cup after it is placed on the skin. In wet cupping, the skin is pierced and the blood flows into the cup. That's why it's called the wet cup. While in dry cupping, there is no piercing of the skin, so it's non-invasive. Cupping is useful in a wide range of medical conditions like fever, chronic back pain, high blood pressure, acne, hair loss, dermatitis, psoriasis, anemia, stroke rehabilitation, infertility, arthritis, etc. Besides the therapeutic effect, cupping removes the toxins from the body, stagnant blood, or it also stimulates the vital energy when it is used over some acupuncture points. So cupping can also be used for rejuvenation or detoxification treatments for healthy people. The cups may be made of glass, bamboo, earthenware, or silicone, as we discussed earlier. Sometimes modern suction devices are used instead of traditional cups. In fact, the modern suction devices are even more efficient because we can control the pressure of the negative pressure that's created uh, through the device monitoring system. Now we'll discuss about cupping in Ayurveda, means how cupping therapy is practiced in Ayurveda or the Ayurvedic version of cupping. If we try to correlate the cupping therapy in Ayurveda, we can correlate it to Raktamokshan therapy of Ayurveda, which is basically the bloodletting therapy. The references for Raktamokshan are available in Kaushik Sutra of Atharvaveda. So it can be deduced that Raktamokshan treatment was present in the Vedic times. That's how its mention comes in Atharvaveda. Of the three main treatises of Ayurveda, Ayurveda has three main books, the Charak Samhita, the Sushruta Samhita, and the Vagbhat Samhita. And this Vagbhat Samhita is again of two books, the Ashtanga Sangraha and Ashtanga Hridaya. Of that, the Charak Samhita mostly mentions about non-invasive methods of treatment. Sushruta Samhita is specialized in the invasive methods of treatment, surgery and all. And Vagbhat Samhita is a mix of both the Charak and the Sushruta, the invasive and non-invasive methods. Uh, so, means it may be surprising for many of you because you may not be aware about the surgery in Ayurveda. Yes, surgery used to be there in Ayurveda, but somehow it lost its steam. Now, the Charak Samhita finds mention of 31 indications of Raktamokshana therapy in various conditions and the sites for Raktamokshan in those conditions. Now we'll see about the different types of Raktamokshana. Number one is Siravi or the Veni puncture. The vein is punctured in this, as we can know from the term itself. The second one is Prachan or incising, means scarification in our cupping therapy. The third one is Shring, that's the animal horn application, means instead of the normal cups that we use in cupping therapy, an animal horn is used, which is hollowed from inside. Number four is Jaloka Ucharan or leech therapy. In this, we use medicated non-poisonous leeches to remove the impure blood. These leeches specifically suck the impure blood. And the last is the alabu, or the dried gourd. Means dried gourd is used as a cup by hollowing up from inside, making a hollow from inside. And the same way, ghat or the mud pot can also be used for Rakta Moksha. This is a beautiful picture explaining how Rakta Moksha is done using jaloka or leeches, medicated leeches, non-poisonous leeches. First, the affected area is cleaned, then slightly uh, the skin is scrubbed using a scalpel or something. It's scrubbed, not punctured or incised. After it is scrubbed, the leech is left there. The leech will start sucking the impure blood, and it will suck till uh, either it is full or till uh, all the impure blood is finished from that area. Once it leaves the patient's body, we'll apply turmeric on the mouth of the leech and squeeze the leech from the tail to the mouth gently. So the leech has to vomit. If it doesn't, the impure blood will cause a disease called Indramad in the leech because of the toxins in that, and the leech will die. And during this treatment, it has to be made sure that the skin of the leech is moist at all times because the leech breathes through the skin. And after that, the leech is transferred to a bottle of water, and arrangement has to be made for the aeration of the water. And this leech could be reused only after 45 days. And with time to time, the food for the leech is given in that bottle. In the 45 days time, the leech rejuvenates itself, and if at all there is any infection that the leech has contracted from the person's blood, the leech will either die or the infection will go. So that's why the 45 days period is maintained. This is the shring as we discussed. It's the animal horn. It's hollowed from inside. And in olden days, the people used to suck it with mouth from the other end, suck the blood from the mouth through the other end. But nowadays we have the suction device, as you can see in the picture. The Siraved. Siraved is also very good treatment for Rakta Mokshana. It's basically using a scalpel inset or something. We puncture the vein and remove the impure blood from the particular area. It's very effective in conditions like gout, where if we see the condition for knee pain, uh, if knee pain is due to gout, we normally see a swollen vein near the knee, and in that condition, we just puncture the knee, puncture the swollen vein with a scalpel inset, and the impure blood comes out. Maximum like uh, around 25 to 25 ml blood we take out, and we leave it. We bandage that area. This In this condition, once the impure blood goes out from that swollen vein, the pain decreases significantly, and it's an immediate treatment. Alabu, in this is nothing but a cup using dried gourd. We just dry the gourd, hollow it, remove the remove the material from inside and make it hollow, and use it as a cup. Even we can use earthen cups also. Now, Ayurvedic cupping in knee pain. The knee is a vulnerable joint. We'll discuss about the introduction. The knee is a vulnerable joint that bears a great deal of stress from everyday activities such as lifting and kneeling, and from the high impact activities such as jogging and aerobics. The knee pain is a common complaint among adults and most often associated with general wear and tear from daily activities like walking, bending, standing, and lifting. Athletes who run or play sports that involve jumping or quick pivoting are also more likely to experience knee pain and problems. The medical conditions that affect the knee are like arthritis, gout, and infections. The knee pain can be a nuisance and even debilitating in some circumstances. It can affect the mobility of a person. Now, further, we'll study how the knee joint is composed of. The knee is formed of the following three bones: the tibia, femur, and the patella. The tibia is the shin bone or the larger bone of the lower leg. The femur is the thigh bone or the upper leg bone, and patella is the kneecap in the anterior portion of the knee joint. Each bony end is covered with a layer of cartilage that absorbs the shock and protects the knee. Basically, the knee is two long leg bones held together by muscles, ligaments, and tendons. If we talk about the muscles, there are two groups of muscles. One is quadriceps muscles in the front of the thigh that helps in the knee extension, and the other is the hamstring muscles on the back of the thigh that helps in the knee flexion. Now, there are tendons also. The tendons are tough cords of tissue that connects the muscles to bones, and ligaments are the elastic bands of tissues that connect the bones to bones. Some ligaments on the knee provide stability and protection of the joints, while the other ligaments limit forward and backward movements of the tibia or the shin bone. We'll again see what all the ligaments are. There's a quadriceps tendon in the proximal part of the patella. Then this is the femur bone, the lower portion of the femur. So these are the two condyles. Uh, the femoral condyles. The This is the medial condyle and this is the lateral condyle. And this is the patella bone. And this one is actually behind, it's the posterior cruciate ligament. And this one is the anterior portion, is the anterior cruciate ligament. This one is actually a cushion, a sort of cushion that holds the knee from moving outside the joint. Holds the Actually it holds the femur from moving out of the knee joint. Uh, it's the This one is the medial meniscus and it's the lateral meniscus. This is the fibular collateral ligament. This is the cut section of the patellar tendon. This is the medial collateral ligament. I think it's done. Now, the most common cause of the knee pain, that's the osteoarthritis, causes the erosion of knee joint. And this erosion or knee damage can be graded as the stage 1. This is the stage 1. In this is a doubtful condition, like there's a minimal disruption of joint space, means joint spaces just starts reducing. This stage 2 is the mild stage. In this, an joint space further reduces, but you can find less joint space, and osteocyte starts appearing. Stage 3 is moderate. In this, the joint space is significantly, this is the moderate stage. In this, the joint space is significantly reduced, and the you can see damage starts coming to the knee joint. And stage 4, the joint space is completely compromised. There is a severe damage to cartilage and bony structure. The bones are literally rubbing against each other in this condition. Now we'll know about the causes of the knee pain. The knee pain can be caused by injuries, that could be mechanical problems, types of arthritis, and other problems. First, we'll see about the injuries. A knee injury can affect any of the ligaments, tendons, or fluid-filled sac or bursa that surrounds your knee joint, as well as the bones, cartilages, and ligaments. that forms the joint itself. Some of the more common knee joint injuries include the ACL injury. It's a com The ACL injury is a tear of the anterior cruciate ligament, one of the four ligaments that connect your shin bone to your thigh bone. An ACL injury is particularly common in people who play basketball, soccer, or other sports that require sudden change in direction. Number two is fracture. The bones of the knee, including the kneecap, can be broken during a motor vehicle collision or fall. People whose bones have been weakened by osteoporosis can sometimes sustain a knee fracture simply by stepping wrong. The third is torn meniscus. The meniscus is formed of tough rubbery cartilage and acts as a shock absorber between your shin bone and thigh bone. It can be torn if you suddenly twist your knee without while bearing the weight on it. Then there's a patellar tendinitis. Tendinitis is the irritation and inflammation of one or more of tendons, the thick fibrous tissue that attach muscle to bones. Runners, skiers, cyclists, and those involved in jumping sports and activities may develop inflammation in the patellar tendon, which connects the quadriceps muscle on the front of the thigh to the shin bone. So again, here we can see the anterior cruciate ligament, the medial collateral ligament, the lateral collateral ligament, the lateral meniscus of the knee, the medial meniscus of the knee, the fibia, the shin bone or the tibia. The femur is here and this is the quadriceps muscle on the top. Anterior portion there is the quadriceps muscle and posterior there is the hamstring muscle. This one is just shown on the side. The mechanical problems. Some examples of mechanical problems that can cause the knee pain include loose body, like sometimes injury or degeneration of the bone or cartilage can cause a piece of bone or cartilage to break off and float in the joint spaces. While as it floats off, it's not a problem unless this loose body interferes with the knee joint movement. As soon as this loose body or the fragment it comes in between the joint, it restricts the movement of joint, and also it will erode or say cause damage to the knee joint. You can you can understand this like what happens if a pencil or something gets caught in between the door hinge. This same sort of thing can happen in the knee joint. Now, iliotibial band syndrome. Uh, this occurs when the tough band of tissue that extends from the outside of your hip to the outside of the knee, the iliotibial band, becomes so tight that it rubs against the outer portion of your femur. The distance runners and cyclists are especially susceptible to the iliotibial band syndrome. I think the other day, Dr. Ali Raza Badami here discussed in detail about the iliotibial band syndrome, so we need not go into the detail. The dislocated kneecap. This occurs when the triangular bone patella that covers the front of your knee slips out of the place, usually to the outside of your knee. In some cases, the kneecap may stay displaced and you will be able to see the dislocation. No need to touch. You can see from outside itself the dislocated kneecap because the patella bone is so prominent, so you can see it from outside itself. The last one is the hip or the foot pain. Like it's a natural thing. When someone has a back pain or a hip pain or a foot pain, the walking style changes automatically. And this altered gait may affect irregular weight distribution on the knee joint, and hence the knee joint can also experience some pain or even injury. Now, the types of arthritis. There are about more than 100 different types of arthritis that exist. The varieties most likely to affect the knee include The osteoarthritis, which is also called the some degenerative arthritis. This arthritis is the most common type of arthritis, and it's a wear and tear condition that occurs when the cartilage in the knee deteriorates with the use and age. This next one is rheumatoid arthritis, the most debilitating form of arthritis. Means it's really painful. The rheumatoid arthritis is an autoimmune condition, means the body attacks itself, that can affect almost any joint in your body, including your knees. Although rheumatoid arthritis is a chronic disease, but it tends to vary in severity and may even come and go. But the frequency, as the disease progresses, the frequency of coming is more than the frequency of going. Means the painful conditions are more frequent, while the relaxed conditions are less frequent. Gout. This type of arthritis occurs when the uric acid crystals build up in the joint. While gout most commonly affects the big toe, it can also occur in the knee. Now there is another condition, pseudo gout. Often mistaken for gout, pseudo gout is caused by calcium containing crystals that develop in the joint fluid. Knees are the most common joint affected by pseudo gout. Last, we'll see the septic arthritis. Sometimes the knee joint can become infected, leading to swelling, pain, and redness. The septic arthritis often occurs with a fever, and there's usually no trauma before the onset of pain. Septic arthritis can quickly cause extensive damage to the knee cartilage. If you have the knee pain with any of these symptoms, you should compulsorily go to the doctor. The other problems, like patellofemoral pain syndrome, it's a general term that refers to the pain arising between the kneecap and the underlying thigh bones, that's the femur. It's common in athletes, in young adults, especially who have slight maltracking of the kneecap, and in older adults who usually develop the condition as a result of arthritis of the kneecap. Then the next is knee bursitis. The knee bursitis is the inflammation of the bursa of the knee. It can occur due to some injury. It can occur due to some other inflammation of some other tissue that's near close that's close by. So this is also a cause of knee pain. Now the risk factors. A number of factors can increase your risk of having knee problems include the excess weight, like increase when the weight is more, it increases the stress on the knee joint. Even while you are doing normal activities like the walking or going up and down the stairs, uh, it because of the pressure on the knee joint, it accelerates the breakdown of the joint cartilage. The next is the lack of muscle flexibility or strength. When the muscles have a sufficient strength, it can help to stabilize and protect the joint. In the absence of the strength, the joint will not be stabilized, uh, and it won't be supported properly. In that condition, the excess load or stress will come on the joint and cause damage to the joint. And if the flexibility is not there, in that case, you won't get the full range of movement of the knee joint. Now, next condition is certain sports or occupation. Like some sports, or they put more stress on the knee joint. Like if you're doing skiing, because skiing boots and are really tough, and also the surface is not smooth. There is regular jumps. There are potential for falls. Same way there is basketball jumps and repeated pounding on knees that happens while playing basketball. And same way when you are running or jogging, knee injury can happen. Jobs that require repeated stress on the knees, such as construction or construction workers or farming laborers or farmers, can also put you at a high risk for knee. injuries. The last is the previous injury. Like if you have a previous history of a knee injury, there is a more chances that you might get a new injury because of the weakness of the injury because of previous injury, weakness of the knee because of the previous injury. Now this figure beautifully explains the different conditions, how the different condition of arthritis manifests in the knee. The first figure, that's the A, it shows the normal knee joint, normal anatomy of the femur and the tibia. Second figure, it shows the both the medial and lateral epicondyles, medial and lateral condyles of the femur. They are equally eroded. So in general, the foot stays straight. The third condition, it shows that the lateral condyles are eroded more than the medial condyle. There is pressure more on the lateral condyles. That's why the knee bends inwards. So it forms like a arch inwards. It's called as the valgus deformity. And the fourth figure, it shows the pressure on the medial condyles of the femur. In that condition, the knee bends outwards or knee arches outwards, and it's known as varus deformity. We, this condition can be clearly, the valgus and varus deformity, you can clearly see from outside, and immediately you can come to the conclusion that the medial aspect of the knee or the lateral aspect of the knee, which is involved or which is eroded. The symptoms. The location and severity of knee pain may vary depending on the condition, cause of the problems. The signs and symptoms may include the swelling and stiffness of the knee, redness and warmth to touch, weakness or instability of the knee joint, popping or crunching noises while moving your knee, inability to fully straighten the knee or to bend the knee also. Now, when to see a doctor? Not everyone goes to a doctor as soon as he gets a pain in the knee. So when you should go and see the doctor? When you cannot bear your weight on your knee, or you feel as if your knee is unstable, yeah, or you are not confident to walk enough. Second condition, if you have marked swelling on your knee. Third, if you are unable to fully extend or flex your knee, or there is a restriction of movement of your knee. The fourth is the when you see an obvious deformity in your leg or the knee. When you see there's a deformity in the knee, you have to consult a doctor. The fifth is if you have fever in addition to redness, pain, and swelling in your knee, you should see a doctor. It could be septic arthritis. It could be. The last is if you have severe knee pain that's associated with an injury, you should see the doctor. Now, how the doctor makes the diagnosis. During the physical examination, the doctor may ask you, doctor may inspect your knee for the swelling to check if there is a swelling, if there is a pain, if there is tenderness, warmth, or any visible bruising on the knee. The doctor may check to see if the movement, how far the lower leg can be moved in different directions. The doctor might push or pull the joint to evaluate the integrity of the structures in the knee. And the next, the doctor might ask for some imaging tests like X-ray, uh, which can help to detect the bone fracture and degenerative joint diseases. We can see a normal X-ray and the X-ray of a person with arthritis here, the top right. This is the normal X-ray of a knee joint. You can see sufficient space is there in between the femur and the tibia. But this next one is arthritic condition. You can see there's a decreased joint space. in between the tibia and femur. So that suggests of arthritis. Now, computerized tomography scan. CT scanners combine the X-rays taken from many different angles to create the cross-sectional images of the inside of the body. The CT scans can help diagnose the bone problems and subtle fractures. A special kind of CT scan can accurately identify gout even when the joint is not inflamed. Now, here we have a, I'm sorry. Now here we have a special type of CT scan. It's called as the 3D CT scan. It's clearly showing the portions of erosion. I guess this should be like grade 3 erosion of the knee joint. Now the next one. Next, the doctor may ask for an ultrasound. In ultrasound, the technology uses the sound waves to produce real-time images of the soft tissue structures within and around the knee. The knee may be moved into different positions during the ultrasound to check for specific problems. We have this in bottom right, we have a suprapatellar ultrasound. Is showing the soft tissues in the suprapatellar region. The last is the magnetic resonance imaging. An MRI uses radio waves and powerful magnet to create the 3D images of the inside of the knee. This test is particularly useful in revealing injuries to soft tissues such as ligaments, tendons, cartilages, and muscles. In most of the cases, the MRIs are really helpful. Last, the doctor might ask for some lab tests, like if the doctor suspects an infection or inflammation, he may suggest blood tests and sometimes a procedure called arthrocentesis, in which a small amount of fluid is removed from the inside the knee joint with a needle and sent to the laboratory for analysis. Now, how we'll do the Ayurvedic cupping treatment in knee pain. The aim of the treatment would be to reduce the inflammation, to align the joint in case there is a dislocation. Finally, we'll nourish the joint to fasten up the repair process. And fourth one, supporting the joint. This using some splint or braces. But this supporting of the joint is not the last, but is it is the method that will be employed from the start till the end of the treatment, and even after the end of the treatment also we'll provide this support to the joint till the knee achieves the full strength or the capacity. Now we'll see the first aim of the treatment to reduce the inflammation. What we'll do, there's a method called water cupping method. This method basically involves filling a glass or a bamboo cup 1/3 full with warm water and employing the cupping process quickly. So what we do is we hold the cup close to the point to be cupped and insert a burning cotton wool swift, fast, and simultaneously we turn the cup onto the skin. So practically, instead of this bamboo or glass cup or even silicone cup, even plastic cup also works easier in my opinion. So below I have put a picture wherein I have used a plastic cup and warm water, and once the cup was placed in the joint, then I did the suction to create the vacuum. And but in this particular condition to reduce the inflammation. Instead of water, we'll be using a herbal liquid called the dhanyamla. Now, how dhanyamla is prepared? What is dhanyamla? Dhanyamla is actually a fermented decoction of cereals with lemons. Now, the ingredients that we'll be using is brown rice, about 750 grams, rice flakes, around 750 grams, horse gram, around 200 grams, puffed rice, larger, that we use in olden days, they used to use larger puffed rice, 200 grams, little millet, 300 grams, kodo millet, 300 grams. Actually, this, in short, we should use multiple varieties of cereals. So cereals provide an ideal medium for fermentation. And then we'll use ginger, 150 grams. It's a good anti-inflammatory herb. Lemon, that's 600 grams, also very anti-inflammatory. Ajwain or carom seeds is also very anti-inflammatory action, around 150 grams, and water around 15 liters. Now preparation, we'll mix all the dry ingredients together and powder it and tie it together into a packet with or potli with using a cotton cloth. Next, we'll cut the lemon and ginger into small pieces, and we'll also tie it in another cloth, cotton cloth. And then we'll take a large vessel and pour around 15 liters of water and put both the cloth packets containing the dry and wet ingredients in the water. We'll heat the mixture for 3 hours on a regular gas stove. We can heat it for 5 hours, 5 hours also, no problem. And after it is heated for 3, 4, or 5 hours, we'll uh, allow it to rest, and then we'll reheat the mixture for 1 hour, 1 or 1.5 hour every 8 hours for the next 5 days. And after 5 days, we'll filter it and store it away from moisture, and we can use it within 30 to 45 days. But whenever we use it, the dhanyamla has to be warm. What is the benefits of dhanyamla? Dhanyamla relieves the pain, stiffness, and swelling associated with arthritis and other painful conditions. It provides strength to the tissue, mainly the muscle tissue. It's highly effective in neurological and neuromuscular diseases. It prevents the wasting of muscles and degeneration of joints and soft tissue. It corrects peripheral tissue metabolism. It removes peripheral body toxins. It improves the movement of joints and enhances flexibility. It soothes the nerves and improves blood circulation, and hence it's very good for the heart. So, uh, dhanyamla is an ideal herbal decoction for detoxification, for purification of the body. So even a healthy person can also use it. Now, using this dhanyamla, we'll be doing this type of cupping, and instead of water, dhanyamla will be here, and cupping will be done. But the sites for the cupping, we'll discuss it here. Uh, because we are discussing the generalized treatment modules, so I'll be mentioning all the different parts where all the knee can get affected, and we'll be doing cups in these all the points, like the proximal part of the knee, or the proximal part of the patella. There could be a problem known as the quadriceps tendinopathy, so we'll put a cup here. The medial part of the knee, there could be medial meniscus tear, there could be medial collateral ligament injury, there could be arthritis of the joint, there could be bursitis of the medial part, bursitis could be there. In the distal part of the knee or the distal part of patella, uh, there could be osteochondritis dissecans, there could be jumper's knee, there could be patellofemoral instability, there could be osgood-Sclatter's disease. In the lateral part, it could be iliotibial band syndrome, or there could be even meniscus tear or ligament tear. So these are all the parts, and in this part, uh, exactly above the patella, there could be chondromalacia or runner's knee, patellofemoral pain, patella or patellar cracking, or bursitis. These all conditions can be there, but this particular portion we cannot put the glass cup or bamboo cup anything because it won't stay. So we might use the silicone cup in the medial part, and we may also need to use the back posterior portion of the knee joint for the injuries to the posterior cruciate ligament and generalized arthritis also. Osteoarthritis also, we will have to put a cup on the posterior part of the knee joint. Now, this water cupping with dhanyam can be done for 3 days, 3 sessions, 5 sessions, 7 sessions, or 9 sessions in the frequency of up to thrice a week. We can do it, and depending upon the severity of inflammation, the number of sessions can be increased from 3 to 9 to reduce the inflammation. After the inflammation has reduced, now the patient will allow the movement of the joint. So in that condition, we'll align the joint in case there is any dislocation. The third will be to nourish the joint. Now the inflammation is gone, the joint is well aligned. The next will be to nourish the joint, and so that the repair process fastens up. Using the same water cupping method to nourish the joint, we'll use a mixture of sesame and castor oil. And this nourishing cupping should be done for a minimum of 5 to 7 sessions. 5 to minimum of 5 to 7 sessions in the frequency of thrice a week, to a maximum of 21 sessions with the frequency of twice a week, because we want to do it for a longer period. So we cannot overstrain your knees. So that's why we'll be doing it twice a week. Now the last, supporting the joint. Right from the start of the treatment, as soon as the patient comes, we'll make sure that the patient uses the splint or braces, so that whatever movement he is doing, he will not injure or hurt the knee more. So we should suggest a proper splint or brace for the condition. Like here we have uh, a brace for osteoarthritis. This is specially designed to provide the outward pressure on the thighs, and also the on the lower thighs and the upper leg, upper portion of the tibia, so that the pressure on the medial condyle reduces, medial part of the knee reduces. Now, more suggestions. Uh, in Ayurveda, we believe that everything in the universe is a medicine. So we don't have any shortage of medicines. And we say an Ayurvedic pharmacy starts from your kitchen. So we have plenty of options. So just that we need to know the right medication for each herbs, right indication for each herbs. Uh, Now for anti-inflammatory herbs, if you're seeing from our kitchen, we can use turmeric, we can use ginger, we can use cloves, lemon, garlic, tamarind, table salt, moringa or drumstick. Now, if you're thinking about classical formulation or ready-made medicines, you can use Murivenna oil, you can use Dhanvandram Thailam oil, Karastara Thailam oil, Mahanarayana Thailam oil. And if you now for nourishing herbs, you can use Urad, coconut, gum acacia, black seeds, moringa, that's the drumstick again, basil seeds, ashwagandha, chia seeds, and the classical formulations could be Murivenna again, and then Shirabala Thailam, Pinda Thailam, Mahamasha Thailam, Balalakshadi Thailam oil. So these all are the extra suggestions that could be used. Here we come to the end of the presentation. Thank you for listening me out. Have a great day. Hope you would consider trying out the Ayurvedic remedies once in a while. Thank you.